It is National Maternal Health Month, and we have Mother's Day, of course, coming up on Sunday, so it's a great time to take a little pause and check in with our moms here in the Midlands.
Absolutely. Now, according to new research, postpartum depression is becoming more and more common across the country. News 19's Rachel Ripp has the story.
We all know that it's no easy task being a mom, but what do we really know about postpartum depression? I caught up with some experts here in the Midlands to learn more. Dr. Ashley Jones is a perinatal psychiatrist with Prisma and clinical assistant professor at USC. She says she's certainly seen a change in the stigma decreasing, with more people talking about and identifying postpartum depression.
We've certainly seen it diagnosed much more often now than we did 10 years ago, for sure. My hope is that we're doing a better job of screening for it and identifying it and then offering treatments for it.
Dr. Tricia Seal, an OBGYN for Prisma and clinical assistant professor with USC, says her office screens for postpartum depression through surveys after the first postpartum visit, the second, and local pediatricians do as well. These doctors say they're most concerned about and watch for suicidal thoughts. According to a study published in the American Journal of Obstetrics and Gynecology, the prevalence of postpartum depression in the United States has increased dramatically over the past decade, from 9.4% in 2010 to 19.3% in 2021.
Having a baby is a stressful time for any new mom. They would tell you that, because there's all these emotional factors. You have fatigue on top of it when you're a primary caregiver. Lifestyle factors, including who's helping you're in your family to help take care of yourself and take care of the baby.
These experts say it's not just one factor, but rather the combination of several changes to sleep, lifestyle, hormones, and more that can tip the scale. Dr. Jones says sometimes postpartum depression can even start during pregnancy.
When we usually see it postpartum, it can develop within a couple weeks. And sometimes we're monitoring till up to a year after delivery. But what we start seeing at first is some changes in sleep.
She says it's important that women know there are resources, 2 FDA-approved postpartum-specific medications, support groups, counseling, and research studies. They say the medical community needs to continue working together to holistically address postpartum depression. Rachel Ripp, News 19 WLTX.
Well, according to these experts, they recommend women get help through womensmentalhealth.org or some type of postpartum support international.
All right.